Jill, are you able to hear us?
Yes.
Wonderful. Okay, and then Dr. Samet, are you able to hear us?
Yes, I am.
Okay, great. So I think we have everybody available and on the line and the sound check complete. So I'm going to go ahead and share our slides today and introduce our participants. All right, so thank you for joining us here this morning. As I mentioned, we have some information that we want to share here at the top of the call. So joining us here today to share this information is Director Jill Hunsinger-Ryan, Executive Director of CDPHE, Colorado Department of Public Health and Environment, Dr. Rachel Herlihy, State Epidemiologist with CDPHE, and Dr. Jonathan Samet, who is the Dean of the Colorado School of Public Health. And to get us started this morning, I will hand it over to Director Ryan.
All right, good morning, everyone, and thank you for joining us. We have with us this morning Dean Samet from the Colorado School of Public Health that's going to be sharing the latest modeling data with you. This is data that we take to the governor and he uses to be able to make decisions, policy decisions. And so Dr. Samet is going to show you some of those models, and we will get into that in a bit. I'm going to start by just making some opening remarks and showing you a few slides. If you all joined us last week, you know that Coloradoans have been very successful in flattening the curve by any number of measures, the number of new cases, number of new hospitalizations, number of new deaths. So stay at home, and Dr. Samet's going to show you we've been able to measure about a week of safer at home. But we have done a good job at flattening the curve. I think that the message, though, to Coloradans is that we are not out of the woods, and that's simply because as mobility increases, viral transmission will continue to pick up. And Dr. Samet's going to show you that around mid-August, the date at which schools generally open, the epidemic curve under all modeling scenarios will rise. It's just the degree to which they rise. There are a lot of things about this virus that we still don't know. It's novel, it's unpredictable, and we still don't know about long-term immunity. And so even though the state has been able to ramp up testing and to have community testing sites in most communities, and we're really ramping up our epidemiological response, including contact tracing. We're still in a phase of loosening restrictions, but definitely not going back to normal. So we need to go slow, and everybody needs to do their part. And on the next slide, if you joined me last week, I will just reiterate, of course, that we all have these goals. We need to make sure that the viral transmission is slow enough so that we don't exceed hospital capacity and run out of hospital beds or ventilators. And this is one of the metrics that the School of Public Health models for us, so we can tell how slow we need to go with our social distancing policies. I think everybody would like to get kids back to school in the fall. It helps parents be able to work better, and also it's just a better educational opportunity for kids. And then, of course, we want to prevent having to return to stay at home. So if we all work together and continue our social distancing practices and wearing masks in public and other prevention measures, then I think we can all control this virus until we have some game changer like a vaccine. But the more the virus is circulating, the harder it will be and the longer it will take to go back to normal. Next slide. So, as you all know, because Coloradans have done such a good job of flattening the curve, and because this really is a dance between trying to suppress the virus but still having economic stability, we can't stay at home. indefinitely. So restrictions have to be loosened. But as they are loosened on a state level or a county level, if a county is able to get a variance, we still ask people to stay at home as much as possible and avoid social interactions. We ask vulnerable populations, including older adults, to stay home, except to perform necessary activities. People are still encouraged to stay within their county of residence or employment as much as possible and not travel outside their county. Coloradans are advised to wear non-medical cloth face coverings when in public. And when going out, people should remember to stay physically distanced from others by 6 feet. And then also, businesses should consult CDPHE guidance. We have guidance now on when businesses have 2 cases, we're recommending they close for 48 hours and put prevention measures in place in order to prevent a larger outbreak. And if businesses are really self-monitoring and if they are taking steps to prevent the virus from just going throughout their workforce, then it will prevent us from having to do more stricter state measures. So we're hoping that between individual responsibility and business responsibility, that we are able to control COVID-19 on a personal level or a business level and not have to do it on a societal level. So when businesses know that they have COVID cases, they should contact their local public health agency. Every county has a local public health agency. So that public health agency can advise them and also help track their cases. Next slide. Wanted to show you, so at CDPHE, we use a lot of data, which we call early warning data in our early warning system. And this helps us tell if the disease is increasing or people's mobility is increasing, and the School of Public Health is really helping us model mobility data. So I wanted to show you what that looks like. So if you look at the graph on the right, and it shows temperature because we know people are more likely to move around when temperatures start to increase. But this chart shows the hours at home. And then it shows how really in March, people started staying home much more when we knew that the virus was circulating widely in Colorado, and then as subsequent orders were put into place. And you can see how that really ramped up and peaked around the 3rd week in April. And then people started to move around a little bit more, a little bit before the Safer at Home order took effect on April 27th. It's not a whole lot, but we are seeing that mobility is starting to increase. And we actually look at this measure on a daily basis. Next slide. And this slide compares Denver Metro to the rest of Colorado. And the Denver metro area, several counties, including City and County of Denver, were actually on a stay-at-home order through May 8th. And so while their curve is similar and their mobility has increased as well, it's to a lesser degree than the rest of Colorado. So we're able to look at mobility data by county, and we think it is very important to see how different areas of the state are moving and interacting. Next slide. So one of the measures that we asked the School of Public Health to estimate for us is the incidence of COVID-19 since the epidemic started in Colorado. They estimate that 170,000 Coloradans have had COVID-19. That's 2.9% of Colorado's population. And you've heard me say it before, in a population of 5.8 million people, this really still indicates that we're at the beginning of this epidemic. Next slide. So now I would like to introduce Dr. John Samet, the Dean of the School of Public Health, and tell you a little bit about the modeling that they are doing for us. So Governor Polis wants to be data-driven in his policies, And CDPHE has a contractual relationship with the Colorado School of Public Health, and they are regularly providing updates and reports to us. What they are measuring, the actual incidence of disease, the estimated incidence of disease, mobility data, and then, as Dr. Samet will show you, scenarios of the increase in viral transmission leading to hospitalizations and ICU bed demand beyond capacity based on different policies, including levels of social distancing. And this slide just shows you the most recent report that we've received from the school on May 22nd, and everybody that's involved in putting together this information. And I will now hand the floor over to Dean Samet.
Okay, thank you, Director Ryan. And as she pointed out, the work I'm going to tell you about comes from a large group of individuals across our universities. I'll just make one comment going back on the 170,000. That will include everyone who's infected. So some of those individuals will have fortunately been asymptomatic and not have actually emerged as cases who would have come to the attention perhaps of a physician or needed hospitalization. If I can go to the next slide. I'm going to tell you about our modeling results that use the epidemiological tool, an SEIR, or susceptible, exposed, infected, recovered model. We use hospitalization data to cue our model into the status of the infection of the epidemic in Colorado. Just as a reminder, and this is really important, there's roughly an average 13 days between becoming infected with the SARS-CoV-2 virus to being hospitalized for those who need hospitalization. So for today, for example, on the 26th, we could look back to the 13th had we had a model updated exactly to today. So as we look forward, we will get more and more a sharper and sharper picture of what has happened since we moved to safer at home statewide and then in the Denver metro area. Next slide, please. So I'm going to show you two pictures that look like this. This is the picture in our report, and it's showing you the number of hospitalizations on a daily basis. And then to the right, you can see some numbers that are the case numbers updated through May 24th. The green curve is mathematically fit to these data, and you can show that it is trending down. So this is a good news picture, but remember the 13-day lag. Now, next slide shows an updated version of exactly the same figure where we've used the additional data through May 24th. So now looking back to May 11th, and you can see that the trend in the green line is still pointing down. So this is a reflection of safe at home and some of the first days of safer at home. So we'll be repeating this towards the week's end to again provide a picture to CDPHE and the governor of how things are unfolding over time as we're at this critical moment of transition from safer at home to safe at home rather to safer at home. Next, please. So everyone remembers hearing about the R0 value. That is the number of people infected by someone who has the infection. And when that number is above 1, an epidemic propagates. And when it goes below 1, the blue line here, the horizontal line, then the epidemic propagation ceases. And what you can see is that through March, the R0 value dropped, and now it is well below 1. And that is why we see the benefit, that declining number of hospitalizations, and of course, fortunately, deaths are following the same pattern. So again, taking our 13-day lag, what we are most interested in, what is most important for what public health measures are needed is where that R naught value goes, and hopefully it will stay below 1. Next slide, please. So now I'm going to move on to scenarios looking forward. So in these prior slides, I showed you where we have been, which is, of course, very important. We're at a good place, and now we need to look forward to say, how do we stay in a good place? So we've made the assumption that under safer at home, we are at 65% social distancing. We perhaps have done better. We'll find out as we go across the month of May. We look at different scenarios of social distancing starting from May, the end of May, the 27th, through November. And we're going to look at different scenarios of social distancing. One with regard to older people, where if we drop social distancing as measures are put in place, the same level of social distancing applies to all ages. Then we're going to look at a scenario where 50% of older people, this is 60 plus in this modeling, maintain a distancing at 80%, about where we were with safe at home. And then we're going to look at a scenario where all older people, 60 plus, maintain distancing at 80%. So let's look at the first one of these. So this plot shows different scenarios, moving to 65% and staying there. That's the white line on the plot, 55% and 45%. And then a further scenario where things change towards the end of June, and we go from 55% down to 45% at the end of June. The dotted line going across is the approximate number of ICU beds available for COVID-19 patients, allowing a margin to take care of all the other people who need critical care. So I think you can see that in the scenarios of greatly reduced social distancing, we exceed that dotted line in all but the 65% scenario. Notice there's an arrow at 3,000, and just remember that we have many in our red, yellow, or orange and green scenarios. We're above 3,000. And with 65%, we are below our ICU capacity. Next, please. So this is now all older adults maintaining 80% social distancing. So note all, the next one I'm going to show you is 50% of older adults maintaining 80%. I just draw your attention to the fact that the scale has changed and all curves are below 30,000. The vertical line, the dotted vertical line, is August 15th, just to show you approximately the date around which schools and universities are starting to open. So now you can see that the 65% line is well below ICU bed capacity, and the 55% curve is as well. And then you'll note that the 55 and 45% scenarios are above. And then the next slide, we'll go to the 50% of adults, half of older adults are maintaining distancing. You can see that now we have numbers above 3,000 for the 45% and the changing scenario, as well as the 55% scenario. So if we go to the next slide, we have all these together, and you can just get a picture of the importance of maintained social distancing and also of assuring that our most vulnerable populations, older populations, and there are other groups that certainly fit within this vulnerable group, maintain a higher level of social distancing. So you can see, just going across, and again, keep your eyes on the scale change in the middle scenario. That's all older adults maintaining the 80% social distancing. We are good with both the 55% and the 65% social distancing. If in scenarios 3, you'll note that with half of the older adults maintaining the higher level of social distancing, the white, the 65% stays well below, and the red creeps above the ICU capacity. And as Director Ryan mentioned, on all of these scenarios around August 15th, we could still be, we're likely to see still rising epidemic curves. So I think that is my last slide, and we'll move on, I think, to Dr. Herlihy. Yeah, and just a quick summary of the main findings. And I think I just actually went through all of these. And again, we're starting to get a look at safer at home. And over the next several weeks, we'll get a far clearer picture of that. And again, the message here about the need to have older people maintain a greater level of social distancing. So thank you, and I think now to Dr. Herlihy.
Good morning. Thank you, Dr. Samet and Director Ryan. So as Dr. Samet highlighted, it is critically important for older adults, and actually really all people with chronic medical conditions, to continue to stay at home and practice strong social distancing going forward. And this is because older adults are adversely impacted by severe disease due to COVID-19, including hospitalizations and death, as shown in this figure. So in this figure, you can see that, we're showing by age group the burden of disease by total number of cases in gray that are not hospitalized, in a lighter color blue, those that are hospitalized, and then in the darkest color blue, individuals that have died due to COVID-19. And so what we are showing here is that overwhelmingly the highest burden of hospitalization and death is really occurring in those older adults. Next slide. And while Coloradans of all age are at risk for COVID-19, older Coloradans are at the highest risk of COVID-19 hospitalization. Next slide. And this is shown in this figure. This is from a national COVID-19 surveillance system that Colorado participates in. And along the y-axis, you can see the hospitalization rate, and along the x-axis is the week. In the tan line, you can see the rate for adults over the age of 65, which is much higher than the rates being seen for other age groups. Next slide. But the risk of hospitalization is actually even higher for Coloradans who are age 75 years old and older. Next slide. And that is shown in this figure here. So this is the same data that I showed in the previous slide, but it's taking a closer look at individuals who are over age 65 in the age group of 75 to 84 and the age group of over the age of 85. And what you can see here is dramatically higher rates among those older adults here in Colorado. While again, we continue to see high rates of hospitalization in adults 65 and older, as well as hospitalization rates that are elevated for those 50 to 64 above younger age groups. Next slide. And this data also translates to severe outcomes in older adults. So unfortunately, 9 out of 10 COVID-19 deaths in Colorado have occurred in adults 60 years of age and older. Next slide. And that data is shown in this figure here from our website. So this figure shows you Colorado deaths due to COVID-19 by age group. Along the y-axis, you see the percentage of total COVID-19 deaths that have occurred. And then along the x-axis, you see different age groups. And overwhelmingly, you can see that the vast majority of deaths have occurred among individuals 85 and older, 75 to 84, and then 65 to 74. Next slide. This figure is a way to look at that data that shows you the percentage of deaths due to pneumonia, influenza, or COVID-19 that have occurred in Colorado. And this shows you data starting from the far left from 2018 to the far right, 2020. And what you can see, if you look at the numbers here, the number 1 refers to the CDC MMWR week, which would refer to the first week in January. And so you can see these peaks occurring typically for influenza right around January through March each year. And so you can see that for 2018 on the far left, and then again for 2019 moving into 2020. What this figure shows you is the dramatic increase in the number of deaths occurring in Colorado when you look combined at pneumonia, influenza, and COVID-19 together. And so you can see that the number of deaths that have occurred in Colorado in the last several weeks compared to what we see typically for influenza seasons is tremendously elevated. Next slide. So there are fortunately steps that older adults can take to try and reduce the risk of COVID-19. Some of those steps including staying home when possible, washing hands frequently, maintaining 6 feet of space between yourself and others. We also know that unfortunately, many individuals who are at home at this time are experiencing stress and need to find additional coping strategies. We know that it's common during this time for individuals to feel increased stress during a pandemic and the fear and anxiety that can go along with feeling those stress and emotions. It's important for older adults to be aware of symptoms and know the timing of those symptoms. So symptoms appear 2 to 14 days after exposure, and it's important for older adults and all individuals in Colorado to pay attention to those symptoms. The most common symptoms are going to be cough, fever, and shortness of breath. Also important for older adults to consider is developing a care plan and working with your family and friends to make sure they know your care plan. A plan that summarizes your medical conditions, your healthcare providers, your emergency contacts, and your wishes for end-of-life care. Next slide. So in summary, we also need to do our own part to protect our Coloradan neighbors, friends, and family who are older adults or vulnerable. Ways that we can all help older Coloradans and people who are vulnerable to COVID-19 here in the state include things like, if you're a caregiver, take precautions to avoid becoming infected yourself. Use tools like FaceTime, Skype, and Zoom to visit with older adults. Make sure to take time for extra calls, letters, cards, and greetings from a distance. Helping older adults and neighbors, family members, and friends with grocery shopping and other errands. Next slide. And finally, while older adults are really those that are most vulnerable to this infection, severe illness is also occurring in younger people. So in addition to the unfortunate deaths and hospitalizations that we've seen in older adults, more than 100 Coloradans under the age of 60 have also died due to COVID-19. More than 1,000 Coloradans under age 60 have been hospitalized due to COVID-19. An estimated 5.6% of Coloradans aged 30 to 59 who develop COVID-19 will need non-ICU hospitalization, and another 1.9% will need ICU hospitalization. And then, of course, there are additional new impacts of this virus being discovered every day, such as the multi-system inflammatory syndrome in children that we've learned about in the last several weeks. Next slide. And I will turn it back to the moderator for questions.
Thank you, everyone. Yes, we hope that information was helpful. And so at this time, we will open it up for questions. So again, if you have a question that you would like to ask, please raise your hand by clicking on the participants button and then the little hand icon so that I can see that you have a question. And then when I call on you, if you could please say your name and media outlet, that would be very much appreciated. And if you would like to ask a specific question to one of our specific participants, feel free to say that as well. Okay. First on the line, I have Zach Newman.
Zach Newman with 9 News in Denver. I have a very wonky data question that I was just curious. So the positivity rate has nosedived in that from the average from May 10th to the 24th is around 7% and 6.8%, and before that it was 2 weeks before that it was nearly 12%, whereas process tests has stayed about the same across that same 2 week chunks. So I'm curious why the positivity rate went down so significantly when the number of process tests each day across CDPHE and then private labs has stayed about the same across this past month.
This is Rachel. I can take that question. So there's two reasons we would potentially be observing a decrease in positivity. One would be a decrease in the overall burden of disease in the state. And then the second would be an increase in testing occurring in the state. And I actually do see a slight increase. We are seeing an increase, certainly over the last several weeks, in the amount of testing that is occurring in the state. But I think just as we are continuing to see decreased case counts, percent positivity will go down when there's a decreasing burden of disease in the state.
Next on the line, I have Vicente Arenas. Oh, sorry. You should be on. Bear with me on this. Okay, you should be on the line now. Sorry about that.
I think you guys can hear me now. Vicente Arenas with Fox 31. Thank you so very much. Have you guys at all been paying attention, or not paying attention to, but are you monitoring any possible cases of COVID that could have resulted after that large gathering that took place at the restaurant in Castle Rock, the CNC restaurant? Is that something you're watching? And have you noticed an uptick in cases after that? Thank you.
This is Rachel. I can take that question. I am not aware of any cases that have been detected due to that event, but that is certainly something that we would be tracking. I think it's important to know that there's typically a lag of about 13 days or so between when exposures occur and when cases occur. And sometimes it's actually also difficult to identify cases with the first generation of cases. So it can potentially take several weeks before we start to see the impact of transmission that could occur from initial exposures.
Okay, Steve Stager, you are next on the line. And you should be unmuted.
Am I on?
Yes, Steve, we can hear you. Thank you.
Steve Stager from 9 News, first-time caller, long-time listener. My question is about the governor's decision to reopen restaurants but not reopen necessarily breweries or bars, wineries, things like that, unless there's food served. Is there a public health reason why a brewery is different than a restaurant?
This is Jill, and I will just say that I'm going to leave that policy decisions to the governor. We've been looking at all sorts of different environments in which people interact. Certainly, the social aspect of bars, can be more risky than other environments where people can socially distance a little easier. I know that doesn't quite get at your question, but that's kind of how we've been thinking about it in general and talking through different environments. And then I'll leave that. You can ask the governor at his press conference this afternoon.
Next on the line will be Jennifer Brown. Okay, Jennifer, you're on the line.
Hi, this is Jennifer Brown from the Colorado Sun. My question is, you can tell by the graphics that you showed that there's quite a difference between 45% and 65% in terms of social distancing and staying at home. Can you offer any more guidance to people on what those look like in real life? I think if you say to most people 45% or 65%, I just don't know how to explain the difference between what staying at home looks like in those percentages. You know what I mean?
Sure. So this is John Salmon. I'll take this on. It's a great question, one we've been working on very hard using different data sets. These numbers come out of a model which tells us in terms of abating the epidemic how well we're doing, and there's an associational link, as you can tell, between the R naught value and the social distancing. What we're trying to do is learn from what's happening over time with how the different measures affect the social distancing, so we can give a sharper answer. We're also looking at how much time people spend in different environments and how they mix with others. For example, older people spend relatively little time in restaurants and bars, but if they do, they're more likely to be with younger people. Houses of worship, for those who go on Sunday, they spend a substantial amount of time, and there's a lot of mixing. So we're actually working with the data sets we have to try and get a better answer to your question. And I think that's one reason that the sort of measured way that the lifting the restrictions helps, because each time there's a change, we can continue to track and observe. And we're trying to get a sharper link from our mobility measures right into this social distancing percentage.
This is Rachel. I would just add, I think, for individuals to think about this, the difference between 45% and 65% could also potentially look like more reducing your interactions with others by half, less than half or more than half. And so I think if we're thinking about 65% social distancing, that means that we're asking individuals to reduce their contact with others more than half of what they typically would be doing. So maybe that's a way to frame it for people.
And this is Jill. As a baseline, Dr. Samet, I know you were able to calculate the percentage of social distancing during stay at home.
Right, and that we reached roughly 80% for the stay at home. So in coming down, we have some leeway in terms of the margin between where we were and where we're going to get to 65%. That really opens up the possibility of reduction of some of the measures as is happening.
Next question will be from Chris Vanderveen.
Thanks so much for all of it. It's very much appreciated. I want to get to the what could be potentially the underlying here. Based upon the data and the modeling from Dr. Samet, it appears as if, and correct me if I'm wrong, that you're preparing the state for a prolonged period for months and months and months of safer at home. And you're also preparing Coloradans who are over the age of 65 that they just may stay at home until the end of the year. Can you help me out here?
Well, I think we'll have to see what policy measures are taken based on these scenarios. I think the message that Dr. Herlihy showed concerning older adults is the correct one. I mean, the figures for hospitalization and death, unfortunately, are quite compelling around the vulnerability of older people. It's clear that we will need to use in the end all the measures we have available, and I think that includes the maintenance of distancing, the use of masks, the case isolation and contact tracing. So all of our strategies. The scenarios clearly show, which I think is part of the point of your question, that we're in this for the longer run, absent, as Director Ryan said, a surprise on the part of a virus that we can hardly say we understand its behavior fully. So if there were, for example, unexpected seasonality, perhaps the picture would look different. But the models for now say that we are in this for the longer run. We will need to have maintained social distancing and assure that those who are most vulnerable are aware that they should take measures to protect themselves.
And I think it's also worth noting, completely agree with everything Dr. Samet said, that Governor Polis is considering policies on a monthly basis, and the modeling data from the School of Public Health is informing those decisions. But we are in this for the long haul. But at this point, we're unable to talk about or even know what policies will look like, for example, in July or in August.
The next question will be from Evan Wylage. Evan, you're on the line.
Hi. I think this question is for Jill. You all present hospitalization data on your website, but you don't allow the public to download the data directly out of the Tableau dashboard. Whose decision is that?
I'm afraid I don't know the answer to that. Rachel, do you know what he's referring to? We can certainly get you an answer.
Yeah, I think, for some data sources, we don't allow data to be downloaded to ensure privacy of individuals. But for individual hospitalization count type data, I don't believe there would be privacy concerns there. And that's certainly data that we would be happy to share with you.
Next question will be from Ray Solomon.
Hi, thanks. I think this question is for Jill. It's about Logan County. Late last week, Logan County was granted a variance from the safer at home, the state safer at home orders. And then over the weekend, there was a significant rise in the number of positive COVID cases that were reported there. So I'm wondering if that changes anything in regard to the variance that was granted late last week.
Sure. And I haven't looked at Logan's data from the last few days, but I will say in general about variances that they are granted based on the incidence of cases within the county over the last 2 weeks, and that all variances have what we call a snapback provision, where we say if your incidence rises above a certain level, then the county automatically reverts back to the state's order. So like I said, I can't comment on Lincoln specifically, but we've got that clause in all of the variances because, as we all know, a county can be suppressing its virus pretty well 1 week, and then you could see an increase. And frankly, different counties have different capacity in terms of their epidemiological response. So we can particularly look into that one. I don't know whether the case is increased enough to warrant the snapback provision or not.
All right, so I think we have time for about 2 more questions. So this one and then one more. So next is from Y. Robales.
Hi, this is Yasmina from Chalkbeat. My question is about school reopenings. Can you talk about what impact school closures did have on the trajectory of the disease up to this point, and what the modeling shows about the effect of how opening schools in the fall will impact the modeling going forward?
Let's see. Rachel, do you want to go first and then I'll go second, perhaps?
Sure. So I think a couple of things. One is that it's challenging to directly and precisely measure the impact of one particular intervention when multiple interventions were implemented at once. And so I think that is the case with school closures, but it is definitely something that we are very interested in better understanding the impact of schools being open or closed, and what the level of impact on transmission may be. And some of the work that Dr. Samet and his team is doing is looking at age-specific contact rates between individuals to really try and start answering those types of questions. And so I will hand it to him to fill in the details.
Yeah, I mean, I think this is an area where there's a lot of uncertainty about the role of schools in general. I mean, we do know that children tend to be asymptomatic. And of course, we have this new pediatric syndrome that's of concern. I think following up on the comments from Dr. Herlihy, of course, schools are a place where children are in contact with one another, but they're also places where adults mix with children, including people who are in the more vulnerable age range. So I think as we look to schools opening, we may have learned more from some of the countries where schools have reopened. And there's some, for example, in Europe where this is going on. So as we head towards August, we should have more information and better understanding of the potential importance of schools, and also a better feel for how important the contact of adults with children in schools may be for viral transmission.
Great. And this will be our last question. Last question will be from Blair Miller. Blair, you're on the line.
Hi, guys. Thanks for doing this again. My question is about asymptomatic people. I know you guys have been talking about it and learning more over the past few months, but you seemed to say earlier that people can be asymptomatic for the virus throughout their illness. And I was just wondering more about that and how asymptomatic spread can happen more as we move to safer at home.
Well, this is John Samet. I'll comment, but others may want to as well. I mean, this is really one of the challenges with the virus, is that there may be shedding by people before they become symptomatic. And that it seems that it may occur for several days. And then some people are asymptomatic throughout the course, and of course can be infecting others because they're not aware that they are ill. So this has been I think, part of the underlying nature of the virus that has led to its, really rapid epidemic spread, and some of the challenges of bringing sort of the usual epidemiological measures to bear. Initially, there are just so many people who were asymptomatic and able to spread the virus. That percentage of people who are asymptomatic is not fully clear. I think one easy answer is it's a lot, and with some estimates even stating that more than 50% of cases could be asymptomatic. But Rachel, please weigh in.
Yeah, I think that's exactly right. I think, as Dr. Samet explained, there's sort of two different types of asymptomatic transmission. One is going to be transmission that occurs from individuals who are what we would consider pre-symptomatic. So these are individuals who might go on to develop symptoms, but they don't yet have those symptoms. And we think for those individuals, maybe up to about 40% of transmission can occur before they have symptoms. And then you have individuals who are asymptomatic the entire time. And that is going to be more common in children in particular and young adults.
Okay. Well, thank you all for joining us here this morning. That was our last question. So we do hope this was helpful. And I believe we will be able to share the slide deck afterwards. So again, thank you all for joining us this morning, and have a great afternoon.